Well, welcome everyone. My name's Kate Stigberg. I'm the Chief of Staff at Healthier United. You're at Disagree Healthier by Healthier United, so I hope you're in the right place. Thank you all for coming. This is our inaugural initiative as an organization. I really appreciate everybody taking their time to be out here. Before we get started, I want to recognize Cody Kinsley. He is our board member at Healthier United, former secretary of DHS here in the state, and wanted to thank Representative Campbell and Senator Mohammed for agreeing to be part of this. And now I'm going to introduce Paul Shumaker, who will run us through some slides and then we'll get started. So thank you everyone for joining.
Thank you all, appreciate the opportunity. We've been in the field, this was done last week. I'm gonna get into a little bit, this is only the teaser, the real poll presentation, the full poll presentation will be on Friday. I think everyone here is invited. If you're not, please take the opportunity to participate. We got a lot of interesting questions here in the process. The survey was done with myself, and let's go to the next on this side of it. Morgan Jackson and I worked on this together. Most of y'all know Morgan as well. We had input in from both sides of the political aisle from those. We did N equals 800. This is March 8th to the 9th. And we're at 3.64 out of 95 confidence level here. This is the teaser part. This is the slide. This is what you will learn about. You're not going to see this tonight. But we asked, it was very interesting. We asked about North Carolina's political environment, the key approval rating of the governor, president, and Secretary Robert F. Kennedy Jr. as well. We also have some ballot test questions in there. We have generic ballot tests on state legislative. We have U.S. Senate race. We have level of interest in the upcoming elections. That information you'll see a little bit of. Interestingly, we did personal health lifestyle goals, what voters say they need, which was very insightful. Healthcare affordability issue set. We did how voters feel about Medicaid, access to health care through Medicaid. We did a whole set on vaccines and people's attitudes towards vaccines. We also did about mental health and youth, and then we did about the tone and the tenor of the political environment, which I'll talk about here real quick on the next slide. Well, actually, it'll be the third slide. Voter intensity, and this is one of the questions that I put into all the surveys, because if you are in the political sphere here, most of you all are, this is not, when it comes to elections, do you normally vote, always vote, sometimes vote. We asked on a scale of 1, we asked that question in the survey, but additionally, I asked this question on a scale of 1 to 10, how would you rate your level of interest in the upcoming elections? The reason for asking that is that when I ask about your behavior, in voting behavior, people tend to lie if they think they're supposed to do something that they're not doing. So when you ask the level of interest, you actually get a better read. And so what you'll see right now in the level of interest amongst Republicans, those who said 10, they were 58.6. Democratic voters were 73.3, and then unaffiliated voters were 60. So right now, there's more energy with Democratic voters in the upcoming election, and their level of interest is much higher. And you can see how it breaks down by geographic regions and the demographic breakouts across the board. But so overall, 8, 9, and 10, 77.6. However, the 10 voters are going to be the ones that show up for sure this election cycle. It'll be interesting to see how they are when you get to the other questions next. Would you say right track, wrong track? Standard polling question. 58.3% North Carolinians said they thought the direction the country is heading, they're on track on the 35.4. If, to keep in mind, talking about the 10 voters. If you're a 10 voter, 33.9 said right track, 62.2 said wrong track. Notice I got a generic D voter and a generic R voter here. We do have a generic ballot question in here. They told me they wanted this to be a teaser. So if you think the country's headed in the right track, if you look at Republican voters, and we've got, I don't know if y'all can see this or not, so I'll move that out of your way. You'll see Republican voters are 79 or 80 to 11. Generic Democratic voters 4.6 to 93.6. Again, another intensity, greater intensity on that side. You see that trend. Then you got to break down by party, Republicans, Democrats, all down. But right now, wrong track, right track, definitely people think we're not heading in the right direction. Do you agree, disagree with the following statements about the quality of productivity of political debate? We finally found something that everybody can agree on as far as Republicans, Democrats, and unaffiliated. All right? Do you think it's on the better tone? The tenor is only dividing the country, making matters worse. 86% said yes, they agree with that. Strongly agree, 2/3, 67.5. On the strongly agree. Republicans, 80.5 agree. Democrats, 91.5. Unaffiliated, 86.5. If you look at the margin of errors, anytime you're above 80, it's pretty much universal. If you look through all the demographic sets, well above 80 across the board. Then, the follow-up to that is about self-censorship. Please tell me if you agree or disagree with the following statement about the political debate. I found myself withholding my political opinions for fear of upsetting a friend, family member, or co-worker. 51.5 said yes, they agree, 45.5. 32 said they strongly agree. I can personally tell you, I have a member of my family, if I say 2 words to them, it will set them off. It's called Donald Trump, okay? And I say that is, I have a sister that it's totally changed. In fact, we will not mention that and have that discussion. I'm sure some of y'all have that same thing in your family as well. Yeah, we got a few heads that are shaking here. Republicans, quite frankly, again, both political parties were here. The next one's a demographic slide. I'm not going to go into that. Here's what I would encourage all of y'all. This is just the demographics of the survey and the breakdown, very much geared towards a general election set of voters. What I would encourage you to do, show up on Friday. We do the webinar. We'll be getting much more detail. We have some great healthcare questions. I actually found this survey to be one of the more interesting ones I've done, just on the lifestyle and the sets that came forth here. And you're going to find the political stuff very insightful. If you're hoping for a big Democratic win in November, understand it's a long ways off, okay? But right now, that's how the winds are blowing. From that standpoint, you're going to see that there. But this is a state that is very, very interesting, and it's a state that the dynamics never stay constant in. It is always moving. So this is going to be a very fascinating year to watch here in North Carolina if you like politics. Thank you very much.
Thank you, Paul. Hello, everybody. I'm Jake Williams, CEO of Healthier United. Fantastic to be with you. I'd like to invite Representative Campbell and Senator Mohammed up to the stage so we can do some disagreeing. Welcome, gentlemen. Have a seat. So, if you haven't been there already, we shared tips on our website about how to disagree healthier. And one of them is don't assume someone's motives. And that tip is going to inform my introductory question here, which is, and I'll start with you, Senator Mohammed, what brings you to this work and why are you a Democrat?
Thank you, Jake. Thank you, Healthier United. Thanks for everyone that organized this wonderful event. Thanks for hanging out with us on a Tuesday afternoon when you could be anywhere, because I think this type of conversations is critically important and missing. For me, I'm serving my 4th term in the North Carolina Senate. I'm one of the younger members of the legislature. When I got elected in 2018, I was the youngest member of the state Senate. I've spent many years as a public interest attorney, started out my legal career representing children and families in Charlotte, a nonprofit, went to the public defender's office. I've always represented the little guy. For me, when I decided to run for public office, I realized that the North Carolina General Assembly has significant power on people's lives. The North Carolina General Assembly has the ability to transform people's life if we wanted to, and or bring significant harm to people's lives. Being an attorney, I thought it was great for me to run for the North Carolina Senate. I won. The people of Mecklenburg County sent me here. They've sent me now 4 times, and it sounds like hopefully a 5th time now. But there's so many critical issues that are impacting people. For me, like I said, representing young people through our criminal justice system, I saw so many barriers. I saw lack of access to health care. I saw that we weren't supporting those that are most in need with simple things like housing, mental health services, and I saw the consequences of that. Because when they're standing next to me in orange jumpsuits when I was a public defender, I realized that we as a state and people have failed our community. So for me, it was a no-brainer. Serve in the North Carolina General Assembly, provide solutions that I can. And while I've been in the North Carolina Senate, I've worked really hard to come up with real solutions. Many of you that know me in the North Carolina General Assembly know that I strive hard to work with my Republican counterparts, even though they've been in the supermajority, and try to provide whatever solutions I can. Sometimes I'm listened to, sometimes I'm ignored. But my job is to advocate for the people that sent me from Mecklenburg.
Thank you. And Representative Campbell, what brings you to the work and why you're a Republican?
Well, my pathway to politics was different. I spent 12 years doing everything I could to say no to running for office. I don't know have any of you guys seen the movie The Matrix? They called me Neo because when they'd ask me, I'd just twist no and avoid it as best I could. I joked that they kind of wore me down, but at one point I told them that I wouldn't consider running for office until our youngest had graduated high school. I'd put my kids through 3 deployments overseas. I was an obstetrician. I was away from home a lot, and I wasn't going to put my kids through being away that much. And if I'm being honest, I was kind of hoping everybody would forget it by then as well and maybe not ask me anymore. And the day after our son graduated high school, they came to my house and started bothering me again. But I think what finally got me to do it is I've always had a sense, an obligation of service to the community. Both, I grew up and benefited for some of the help of the community. I grew up incredibly poor, single mother home. So I felt an obligation that I was able to succeed, to give back. And I did that both in medicine, and then I spent 9 years as a soldier. And I think at that point, when my son had graduated high school, I was itching to do service again. And I kind of realized, too, if I'm going to complain about the political process and things not happening the way I wish they would, but I'm constantly avoiding being a participant in it, it's a little bit cowardly, if you ask me. And then how I became a Republican, I think that there's not as vast chasms between the parties as that we like to think there are. I'm a big proponent of stoicism and individualism, and I do think in general, if there's an extra governmental way to solve a problem, that tends to work better. But I think you're going to learn from both of us. We're not going to sit up here and say, well, I'm a Republican because Democrats are evil or things like that. It's just my philosophy matched that party a little bit closer.
Thank you. I'm going to get to this debate question, but before I do, I actually want to preview the final question of the night, which is going to be, what are 3 things that you admire about each other? So I'm giving you a heads up in case you need to think about it. There's also a notepad here in case you need to write it down, or you can just memorize it. All right, so our debate question, small one. If legislative passage was guaranteed, but you still had to consider our budget realities, what policy would you enact to improve health outcomes in the state, and how would you pay for it? I'll do it one more time, okay? If legislative passage was guaranteed, but you still had to consider our budget realities, what policy would you enact to improve health outcomes in the state, and how would you pay for it? Over to you, Senator Mohammed.
So, for me, this question, the answer to this is a no-brainer. I think we've all heard of this saying that a true test of a society is how we take care of our most vulnerable people. So right now, you've heard the Department of Health and Human Services, you've heard the governor talk about this. We have a Medicaid rebate shortfall of about $319 million. We've got over 2.8, 3.1 million people on Medicaid. These people are our most vulnerable: neighbors, friends, family members, community people, young children, people with intellectual and developmental disabilities, our seniors. So when you have a $319 million shortfall and people's critical health care needs need to be met, for me, that's what I believe the General Assembly should come back and address, because that's going to immediately address people's outcomes, whether it's mental health issues, substance abuse, whether it's a senior who's trying to make sure that they have access to a hospital or a clinic, whether it's a parent who's got a child with autism and developmental issues. We don't want to leave people in the dark. And for me, I believe the General Assembly has an obligation and a duty to make sure those needs are met. Now, your next question was, how do we pay for it? Again, for me, that's easy. North Carolina has drastically reduced our personal income and essentially by 2030 is eliminating our corporate tax rate to 0%. I believe our state's going to be the only state that's proposed an elimination of the corporate tax. For me, that's a travesty. We have significant needs when it comes to making sure that we take care of our state employees who show up to do the work every single day. We have educators leaving the classroom who aren't feeling supported. And then we have our most vulnerable who need access to health care. The decision that North Carolina and elected leaders, myself and others, need to make is either you're going to spend the money now in a preventative way and provide the supports to people that need it the most, or you're going to spend it in the emergency room. You're going to spend it down the road. You're going to spend it in our criminal justice system where we're building prisons instead of building people. So you have to make a decision where is more fiscally sound policy. So for me, if you pause the scheduled tax reductions, whether it's personal income tax or corporate tax, it's my understanding that's almost $1 billion in revenue that we can save right there. The projected scheduled tax reductions over the next 10 years, is my understanding, are almost over $13 billion. So that's one or two simple ways. The other suggestion that I would have is you got to restore the caps on the voucher programs. I don't believe in North Carolina that we should be subsidizing private education for the wealthiest families in our state, especially when we have vulnerable people who are on the verge of losing their access to health care. That's almost $210 or $209 million right there that we could save a year if we restored the caps on income when it came to the voucher program. So I think these are the simple, strategic, and common sense ways where you can actually have budgets and policies that reflect our values to make sure we're taking care of our most vulnerable instead of spending more money in the long run, money that we can't afford to spend with the fiscal policies we've seen out of the General Assembly.
Rep. Campbell, what do you think? Restore the Medicaid budget shortfall by raising or at least pausing the personal income tax and corporate income reductions and cap voucher programs. What say you?
I'm for making up the Medicaid rebase, but I think that there's a couple things that we have to point out here is that we can have a formula where a dollar amount is told to us without a background of how they calculated it, or we can go with a nonpartisan fiscal research division number and make up that. And I'm all for, if you can show me that the money has been calculated appropriately, I think that we're going to meet that need, and I think we're going to meet that need fairly quickly. In terms of what I would do for that question, those of you that know me, I hate omnibus bills. I hate big, comprehensive, because I think they're made more terrible with each page that you add to it. So my philosophy is that you find a shortcoming that's hurting patient outcomes and you improve that. So you'll find that we agree a lot on the value of preventative care. And so let's talk a little bit about rural health care in North Carolina. That's where I would focus my attention with this, and I promise I'll tell you how we'll pay for that as well. So we have roughly 80% of our counties in North Carolina are rural counties. We have, especially in the northeast and the southwest of the state, we have counties that do not have hospitals. We have patients that have to travel over an hour to find any healthcare provider. We've got to make that up, and we've got to find ways to do it. So here's what I would recommend. We need to address the workforce shortages in healthcare, both physician providers and then there are other healthcare workers. So I would take, and I'm going to give you a 5-year map here, and I'm going to spend about $5 billion to do this, and I promise that I'll tell you at the end how I'll pay for it. We're going to split that almost in half, where part of it is going to go to our university systems to expand the class sizes of medical schools. But then if you only do that, you're not going to fix that issue. We've got to work with the federal government to expand residency programs for graduating physicians, specifically primary care residency programs in rural areas. Because if you don't deal with the supply, then they're driving forever to get there. Take the other half with university systems and our community college systems, and I'm biased, our community college system is the best one in the country. Nursing programs, RNs, LPNs, radiology technicians, behavioral technicians, physical therapists everywhere. There's a shortage everywhere, okay? Start building that workforce, but then we've got to figure out ways to get them to go to rural areas, and then we've got to get ways where they can stay. I'm all for loan repayment. When I went to medical school, I borrowed every penny I could. I worked every odd job and did every medical experiment, guinea pig opportunity I could. But for loan repayment programs where we get practitioners to go to rural areas, they're marking time. And as soon as that loan is repaid, they move away. So we need to look outside the box. Keep that, but look at ways like low interest or interest-free loans to build their own brick and mortar practices, interest-free loans for a mortgage, things that allow them to sprout roots that when that loan is repaid, they'll stay. Okay, so I gave you the figure. Let me tell you how we're going to pay for it. We're going to start with, there's something I'm sure a lot of you have heard, it's called the Rural Health Transformation Program. This is a $50 billion allocation from the federal budget to states to help with rural health care. We are roughly in this first year going to get about $214 million. Now, I can comment later about what the current plans are for it, but so let's take that out, $215 million roughly. So that's about $1.1 billion over 5 years. We identify things in Medicaid that are being wasteful or not with patient benefit, things like the overuse of ABA therapy. We spent a couple of days and found potential $110 to $210 million savings every year with that. We're going to draw back the CON program a little bit, so the oversight for that, there'll be less expenditures for that. And then we actually get serious about fraud. So if we do all of that, that 5-year plan, $5 billion, will cost the state in new spending nothing. It will be free because we can find ways to use it. And the Rural Health Transformation Program, I have issues with how we're planning to spend it, but I'm open to that. So if we want to make the biggest impact, and speaking to what you said, we're going to pay for it in the primary care's office, or we're going to pay for it in the emergency room. So if these folks, I grew up in rural North Carolina. If you're having to drive 2 hours to see a doctor, you don't go see a doctor until you're really sick, when you need the emergency room or things like that. So if we can get primary care providers in the rural areas that can get them started on glucose control and insulin, dietary changes, those are pennies on the dollars instead of spending $30,000 when they show up in the emergency department with diabetic ketoacidosis. I know that was long and wonky, but I'm sorry.
No, it was great. I'm a wonk. So, Senator Mohammed, what do you think about Representative Campbell's proposal for a workforce and how to come up with that $5 billion?
Look, I think those are wonderful ideas. I think we definitely need to do that. But when I'm looking at what's urgently needed and what needs to be addressed, if we were to come back and if we could do whatever we need to do, I, again, fundamentally think Medicaid rebates is the critical starting point. I think it's aspirational to hopefully work on workforce development. We've talked about scope of care and other things have come up. I think Representative Campbell's right. People get their education, they come, they serve in rural parts of our community. The reality is, especially younger people, they're wanting to come to Raleigh, they're wanting to come to Charlotte. And we do need them to stay in rural North Carolina. But the problem is, I think it's a more holistic, it's gonna be a long-term plan to figure out how do we rebuild rural North Carolina. It can't just be healthcare, but it's also about bringing industry and jobs there. So young people and families want to stay in North Carolina and continue to grow those communities. So I think those are long-term solutions. When it comes to CON, we've seen the CON repeals that the General Assembly passed when we did Medicaid expansion as part of the deal. Many of those went into effect into November of 2025. I think the jury is still out on how much cost savings we're actually seeing from CON repeals. But again, for me, going back to an immediate, effective way is Medicaid rebase. The $319 million needs to be found. We have it, and we need to have sound fiscal tax policy that's responsible. I'm all for tax cuts. I have no problem about tax cuts. But when we're rampantly going down tax cuts drastically fast, and we're not critically thinking about our long-term needs, we're a growing state. Mecklenburg County, our region where Representative Campbell and I are, there's 160 people coming there every single day. I mean, our state is drastically growing, but the revenues aren't coming with it. And for me, what good is Medicaid expansion? What good is a Medicaid card if you don't have access? Along with funding Medicaid rebates for me, I would also look at reimbursements rates because we're providing access to health care to people, but the providers aren't being taken care of like they should. Again, I think this is just basic common sense. This is where the funding allocations need to be to take care of our most vulnerable people. These are not people that are committing fraud, people that are over 65 years old, children. These are people with life happening to them. And for me as an elected official, I don't think this is a Republican issue or a Democratic issue. This is a basic moral issue. We have to take care of our most vulnerable people to make sure that we ensure positive outcomes, not only for them and their families, but even public safety and for generations to come. So that's what I bring it back to you, Jake.
There were two significant 16-year birthdays this month in my life. The first was my oldest daughter turned 16, and the second was yesterday. It was the 16th birthday of the Affordable Care Act, the ACA. And my question for you, I'll start with you, Representative Campbell. Are we better off as a result of the ACA, and where have we fallen short?
No. You want a little more than that? Look, keep in mind my background, I've been a practicing physician. I have a degree in health policy and administration, so this is kind of my jam. But when I'm taking you into the development of the Affordable Health Care Act, I think that there was a group of people building that truly had righteous intentions. And even if outcomes don't always come out perfectly, it is important to recognize that most of the people involved had good intentions. They saw people without health coverage. They were trying to find a way to get them better health coverage or health coverage at all. There were also people that were developing this that wasn't their primary goal. Their primary goal was either to go to a single-payer healthcare system, further government control of healthcare decisions and things like that. But there was a spectrum, and we shouldn't paint everybody involved with this badly. But I will say the biggest thing that the Affordable Care Act accomplished was it forced millions of Americans to purchase a product that they cannot afford to use. So when they developed the ACA, the government was now entering into offering products and competing for products. Well, we remember if you like your coverage, you can keep it. If you like your doctor, you can keep it. We know those things didn't happen, but one of the biggest damaging parts of the ACA was when they designed it, they realized that a lot of employees had great health plans, good coverage, they were happy with it, they didn't have skyrocketing deductibles with it, and they knew that people would go to that instead of exchanges. Well, the exchanges needed a certain amount, a big enough risk pool for them to make it financially feasible. So they introduced what's called the Cadillac tax. So if you were an employer and you offered a really good policy and it was better than what the exchanges offered, you were going to get financially penalized for that, fairly severely. Well, what did employers do? And I don't blame them for this, is they said, well, we're not going to offer those anymore. It's cheaper for us to offer less coverage, worse plans. So essentially, Americans developed employer-sponsored healthcare plans that became catastrophic plans. I'll give you an example. Until I came to the state with my employer, my deductible before the Affordable Care Act, before my 80/20 kicked in, I think was $1,000 that I had to spend out of pocket before any coverage started. It's currently $12,000 before 80/20 kicks in. Because again, they are not going to offer these type of plans if they're going to get financially penalized for it. So the data is clear. Healthcare expenses did not go down as was promised by this. Healthcare expenses went up, and there's a lot of data that shows they rose quicker after ACA than they were rising before the ACA. There were a lot of people involved that had great intentions, but in the end, it's one of those giant government omnibus bills that says, I'm from the government, I'm here to help, and you're like, oh God, please, can I just get a little less help?
Senator Mohammed, what say you?
Look, I fundamentally believe that healthcare should never be a privilege, especially in the year 2026. It should be a promise for every single human being. Nobody, no family, nobody should be a cancer diagnosis or a car accident or something traumatic happening from their life from it being devastated. You have to have access to healthcare. I got young kids. I mean, they're always getting hurt. I don't know what my family would do if we didn't have access to health care. So I'm thankful that I get it through my employer, but I think the Affordable Care Act was a step in the right direction. I think it definitely needs work, and I'll say that as a Democrat. It definitely needs work because I believe that we need much more expanded access to health care. I'm thankful that the General Assembly finally decided to do the right thing by expanding access to health care to over almost 700,000 people now in North Carolina. I'm deeply concerned about the passage of the Big Beautiful Bill and what that's going to potentially do to expansion in North Carolina. But I think it was a step in the right direction. We definitely need to do more. You had states like Massachusetts under Governor Romney, a U.S. senator, who had public options there. I think the Affordable Care Act should have been more robust, where if you want to keep your health care, you can through your employer or purchase it yourself. But I genuinely believe that the general public should be able to figure out a way to purchase access to health care, at least through some sort of state exchange at some sort of affordable rate, whether it's figuring out a way how to buy into Medicare, whatever it is, because Representative Campbell is correct. I mean, the costs are astronomical. I mean, we need to figure out how to address the rising costs in healthcare. The General Assembly's tried to do that with looking at facility fees and other things. We've talked about CON, but I think there's much more nuance to this, and definitely deeper looks need to be taken to figure out how we can make sure we're expanding access to healthcare to people by bringing down costs. The Affordable Care Act was a step in the right direction, but the federal government and the state can and must do much more, especially in the year 2026, where people are still going by without access to health care. And for me, that's unacceptable. That's the bare minimum we should do for every North Carolinian. And I'll go further. If we have money to spend abroad on other things, then we can spend money on our people for their mental health needs. As a Democrat, I fundamentally believe we gotta take care of our friends and our neighbors. If you can find money for other causes and other needs, then you can find money to take care of your constituents. So it's a shame on Washington, D.C., that every single day they haven't been able to figure out how to tackle real problems. And I hope people like Representative Campbell and I, Democrats and Republicans, can come together to genuinely solve these problems because, like I told you, Jake, I think Americans are sick and tired of the drama. They're tired of Americans going into, Democrats and Republicans going into their own corners. We have real problems and challenges. The American people and North Carolinians want politicians to be gone, and we want to see public servants. We want to see public servants that are not putting Republicans and Democrats ahead, not putting special interests ahead, but putting their needs ahead. And that's what's sorely missing in not just Raleigh, but especially in Washington, D.C.
Before we enter the final phase of the program here, there was some breaking news before this event with Senator Berger conceding his election. And so I want to touch on that real quick to see if either of you have thoughts on who you'd like to see assume his role in leadership. Who wants to go first?
Well, that's easy. I'm not going to comment on that one bit. But, and honestly, as a House member, if there was someone I really wanted, if I said that, it might hurt them. But so I'm going to punt to Senator Mohammed, but I will make one point before we leave this. And I think that we as a state and as a nation have to stop conflating insurance and access to care. Because from a political standpoint, when the ACA was pushed through, from the political standpoint, it had nothing to do with going up there and saying we've got health care for more Americans. It had everything to do with to say we have insurance for more Americans. And what I mean by that is if you're a blue-collar worker, let's say you're making $25,000 a year and you have a family and you're scraping by, and your deductible's $12,000 before any coverage kicks in, but you have a plan that you're paying for, you don't have access to health care. And we're going to have to be honest about that it's not just saying, okay, we forced you to buy a product, you now have access, when all we've done is taken more of your money out of your pocket, but not improved your ability to get health care at all. In terms of the President of the Senate, Senator Mohammed, I'll let you comment, or you can be President of the Senate.
Look, I agree with Representative Campbell. I think if I endorsed any candidate on the other side of the aisle, it would probably hurt them. So I probably shouldn't do that either. But look, I have fundamental disagreements with Senator Berger over the years, but I respect him. He's served the state for many, many years, and I wish him all the best and thank him and his family. I've realized since being in the North Carolina Senate since 2019. It's not just an elected person that serves, it's your entire family that serves. It's not an easy job. Everybody's a critic, but I fundamentally believe, again, Republicans and Democrats, we need to understand that it doesn't matter what your political affiliation is. People elected you to come and serve and be their voice. So I fundamentally like to think of it as a way that this individual, whoever that elected person is, they're coming at it with good faith. We might have policy disagreements, and we can figure out a way to talk to each other about adults, like adults, and figure that out. But again, I just wish Senator Berger all the best, and I'm looking forward to working with whoever becomes the next pro tem. And hopefully we can bring generational change and move our state forward and pass Medicaid rebates.
Boy, we both dodged that well, I think.
I tried, folks. Before we got here to this stage, Kate and I spent a lot of time going around the state asking North Carolinians about what they thought about the quality of our political dialogue in this country. And you saw some of it, that sentiment communicated in what Paul presented with our poll, but I think it's useful to hear it directly from the mouths of folks. And before you see this video, which is only 2 minutes and 30 seconds, I'll just tell you that we didn't have to cherry pick at all, because I think 100% of who we spoke to basically had a very similar view. So I'd like to just play this video real quick, and then let's talk about it a little bit. Go ahead. You can stay right here. I'm just getting out of the way.
We're not listening to each other. We're not cooperating. We're not really looking at what's best. Like so much else in society, there's two sides, and everyone's attacking the other side or taking a position, rather than really looking at what's best or what's healthy.
I think it's clearly gotten very divisive and very bifurcated.
What we're lacking in general political discourse is like a baseline decorum and respect for each other.
It's either my view or your view. So I would love to see a world where, what do they say? Agree to disagree. Right? I think you can tell me what you think about something. I don't have to tell you I hate you.
My instinct is that it is probably the most broken it's ever been. Going back to my mother, for instance, we've had to come up with this short form way of being close still, trying to avoid and tiptoe over these things. Since it's gotten as heated as it's gotten, I've full on closed the curtains.
What do you think about all the debates that are going on these days in politics? Do you think it's productive, unproductive, somewhere in between?
I think it's completely unproductive. I think, me personally, I believe that that's what this country thrives off of, is division in the first place. I feel like our government thrives off of that, thrives off of us being divided.
I mean, anything with politics nowadays is going to be unproductive. Just two sides butting heads too much, not getting anywhere with any consensus. So that's kind of the problem. But yeah, I've seen all the debates. I find it incredibly fascinating. But the problem is nothing's getting done because both sides are butting heads so ridiculously hard.
On two completely different pages, no one disagrees. So it's not good for the country.
And you think in 10 years it's going to be better or worse or the same?
I think it depends. Okay. I think it depends. I think it could go either way. Hopefully better. Thinking about it realistically, probably won't be, but you hope that it will be.
How would you grade our emotional and mental well-being right now?
Oh, pretty low. Pretty low. I would say we're more so at the bottom of the totem pole currently.
And in 10 years, do you think it's going to be better, worse, or same?
In 10 years, I believe that it can get better if, as a whole, we want it to get better.
I'd like to pick up where we left off with the video in terms of how do we get better? How do we get better at doing this, at doing what you guys just did? Having a debate, having a disagreement without ripping each other's heads off and being civil. How do we get there? Go ahead.
This and I appreciate the invitation for this because this is something that's been very important to me. My entire life of being interested in policy is that we have to do this better. And if I could, I'll share a story which will tell you why I think we have to be better and why it's important. Despite countless political consultants and campaign managers that want to make my service overseas more than it is sometimes, I was a surgeon over there. There are not many of us. They would wrap us in bubble wrap. They were very protective of us. And so 99% of the people over there had harder, more dangerous jobs than I did. But I finished my career with the Special Forces where we had to go out and do everything that they did. Okay, well, why am I saying this? Because there was one time, my final deployment, that there was one night where I was in a situation where I had the realistic expectation that I said, this is it. I am not going to see the sunrise tomorrow. This is it. My life is over. I'm not going to make it through the night. And I remember forcing myself to think of good memories because I thought if these are going to be my last memories, I want them to be things that I was proud of and that I was happy about. Why am I saying this? Because, spoiler alert, we're all going to die. Hopefully not anytime soon. But when you're on that deathbed, if you're thinking about the highlights of your life or who you owned on Twitter, who you burned on Facebook, or someone pissed you off and you got back at them. I was debating something in joint session and I got Muhammad really good. If that's what you're thinking of, you blew it. You really blew it. That night, as I was preparing for what I thought was going to happen, I thought about my wife and my kids. I thought about friends that had come to help us when we were struggling, and I thought about the times we helped other people that were struggling, and all this other superficial one-upsmanship that we do, especially in politics. It's meaningless, and it doesn't make the ball move forward. And Senator Mohammed and I, we're in different parties, and we'll probably find more issues than not that we disagree on. But we want the same thing. We want a successful state. We want happy people, safe people, people with opportunity. We'll disagree often about how you get to that goal. But even when we disagree, I do not question your motives. Your motives are as righteous as mine. Our philosophies are different, but motivations can be the same. So honestly, the way we make this better is that we encourage others to adopt that philosophy. But I think especially in the time of social media, we have to stop being afraid at dismissing those that are doing what I call politainment. That it's outrage and hyperbole is a means to an end, and the end is clicks and attention. I hope that everybody here tonight, I hope that we set a good example. We certainly tried to. This is not an act. I like this guy. I'm sorry. He's Democrat and I like him. Deal with it. I hope that we all leave this recognizing how important it is to disagree. Oh, here we go. Disagree healthier. You know, he didn't tell me to say that. So, but it's not any more complicated than that. We know what needs to be done. Sometimes it's just harder to do it than to not, but it doesn't change the fact it's important.
Thank you. Over to you.
I mean, everything, amen to everything Representative Campbell said. Look, here's the sad reality. You're going to hear a Democrat and Republican talking today, one from the House, one from the Senate. We're both from North Carolina. We're close regionally, our districts as well. But the sad reality is this conversation is not going to go viral. It's the reality. Now, if Representative Campbell and I are at each other's throats and saying the most craziest, atrocious things, social media rewards that. People love that stuff. And that's the sad state of the world that we currently live in. I think real change, and I'm not just saying it, it doesn't start from elected leaders. It begins from the people. We get the elected leaders, not the ones that we sadly need, but the ones that we deserve. So you have to begin to have thoughtful conversations with your friends and your neighbors and your family. I think the earlier gentleman that talked about with the polling that said you can't say Donald Trump in my family or something's going to happen. I mean, that's a sad reality, but we have to be able to separate ourselves. But look, we can just have a conversation. It's not the end of the world. We can agree to disagree healthier. But I think the change begins with you, the people, our children. I have young children, like I said, our children are watching. When we see elected officials yelling and screaming, we're setting a terrible example. When we're, as parents, at each other's throats on social media and trolling one another, we are setting a terrible, terrible example. And it's bad. It's bad for the future of this country. That's why you're seeing gerrymandering rewarded left and right. Think about it. You saw President Trump with Texas. So Texas said, hey, we're going to gerrymander these congressional districts. Then you heard California saying, well, if Texas is doing it, we're going to do it too. Then you got Republican, Democrats, states going back and forth about, hey, we're going to gerrymander the hell out of our states. Who's actually winning in that battle? It's not the American people. When you have Republicans and Democrats, like literally, gerrymandering, nobody can take me out from my Senate district unless it's a Democratic primary. With Representative Campbell, same thing. No Democrat's going to take him out. The only way he can be taken out is through a Republican primary. So we are rewarded by being more vicious to each other. That's what gerrymandering has done. We have no incentive, Representative Campbell and myself, to come together and work together to solve real challenges and problems. And that's the sad reality. And I give that credit, sadly, to a lot of the consultants and other folks who are making a lot of money on getting people to pit against each other, the media. So again, the people have to say, when is enough is enough? When are Republicans and Democrats going to actually come together and solve my problems? Because your bickering and your bantering and your fighting with each other isn't going to help me pay my Duke Energy bill. It isn't going to provide me access to health care. It isn't going to provide the American dream for so many young people who are desperately trying to achieve it. So the change begins with us. Talk to each other. Get to know each other. Don't take everything so personally. It's okay if you don't agree. It's not the end of the world. There's different perspectives, there's different ideas. And have your elected officials hold them accountable to that same behavior. All that bullying, all that nastiness needs to stop. It's bad for our mental health, and it's bad for the future of our country.
And as promised, as we end here, 3 things that you admire about the other person.
I will say, tacking on to what you said, when we first shared this flyer for this event, the first comment I got was critical of me, that I can't believe you're sitting down with Senator Mohammed. And I very politely replied and said, deal with it, because it's how it's supposed to. So 3 good things. He actually represents a district that I used to live in, but he checks the boxes for me as a person and as a colleague, is that he's honest. He's going to tell you what he believes, and more importantly, he's going to honestly tell you why he believes it. If we disagree on something, we can walk out of there side by side and still be friends. And I think that his motives, regardless of the methods he wants to get to his goals, his motives are righteous.
Senator Mohammed.
Likewise, Representative Campbell, he's a physician. He's got family too. There are so many other things he could be doing right now instead of serving the state legislature. I've realized as a young attorney, it is fiscally devastating for you to serve in the North Carolina General Assembly. Okay?
We can agree healthy on that.
The General Assembly does not like to go out of session, as you've noticed. I've missed the birth of my child before, almost. Thankfully, she came on Veterans Day, my youngest, and it all worked out. But look, I think we need more public servants in the General Assembly, and I see that in Representative Campbell. The other great thing about him is that he's new. He hasn't been broken yet.
Working on it.
Serving in his first term, he hasn't become too much of a pessimist. So I hope, what I realize that he sees that there's strength in leadership and working across the aisle, having conversations and talking to each other. I think it's amazing that he's a physician because he has real life world experience on the issues that we're talking about today. He's dealt with it, he's seeing it every single day. And I think the General Assembly needs more people that have real life and work experience in their life that they bring to the General Assembly to solve those problems. I'm not a healthcare expert. I've learned a little bit here and there, but I haven't lived that life like Representative Campbell have. I've had a life as an attorney in the criminal justice system, in our courts. That's been my area of expertise, and I believe in deferring to the experts. So that's that. And then lastly, I mean, I'm sure he's a wonderful human being and a family member. I've got to know a little bit about his family, and I want to thank him for his service not only in the North Carolina General Assembly, but to our country as a veteran. So that tells me his heart's in the right place, and I can't wait to continue to serve with more Republicans and Democrats like Representative Dr. Grant Campbell.
Thank you.
I just wanted to end by thanking and congratulating you all. I know this is a very small thing, it's a little event, you're gonna have a cocktail or something after that. It doesn't feel like a big deal, but trust me, it is a big deal. I truly believe that our democracy is a living organism, if you will, and we're all a cell within it. And how we interact with each other truly, truly matters. And in case you don't believe me yet about why I should be congratulating all of us for doing what we did here today, even if you just sat there and spoke with your neighbor, I'm going to tell you a little secret. This is our second event, technically. This is our first completed event. At our first event in Denver, a protester showed up because they didn't like somebody who was on the stage, shouted me down, shouted everyone down, shut down the whole proceeding because they disagreed with the opportunity to have two people have a disagreement. So this is a real live issue, and again, I congratulate you all for participating here with us. It's been fantastic to actually finish an event. Representative Campbell, thank you. Senator Mohammed, thank you. Thanks all for being here.